All right. Welcome to the Clinical AI Academy. This is the first video of the Clinical AI rounds. It's a series that we're going to talk about clinical cases where AI is used and try to understand AI from it. So the first case is titled as AI as measurement, not a diagnosis. So the clinical case is, let's say you are reviewing an MRI report. You're a neurologist reviewing an MRI report for a 68-year-old female with mild cognitive symptoms. And at the end of the report, the radiologist adds AI-assisted hippocampal volumetry within normal limits. So what does that mean? What does AI normal mean? So AI-derived volumetry is, first of all, a measurement. And it's not a conclusion, it's not a diagnosis. So there are a measurement done using AI, using algorithms that gives you a number. So the algorithm segments, so like goes and try to find the margins of the hippocampus, segments the hippocampus using specific AI algorithms, and then calculates the volume of the hippocampus and compares it against a reference data set. So it calculates the volume and then compares it to a reference data set. And that data set is what defines normal. So the normal in this case is compared to a data set that the AI was trained on. So it is rarely universal. You have like different scanner protocols, you have demographics, you have different comorbidities, maybe you have patients taking different medications. All this affect this baseline, this data set. So when we say or when we see that something is within normal limits, the right question is normal for whom and according to what? According to what data set? So these models that we use are extremely precise at quantifying subtle changes, but they lack context. So you need to provide the context. They don't consider, for example, other scores that you calculated for the patient, not yet at least. So you don't consider, for example, cognitive scores, the vascular risk, medication history, as we said before. So this is, you could look at it as if it is like a lab value that has not much meaning without the clinical correlation, the mighty clinical correlation. So the AI metric in this case needs interpretation. So let's say in this case a normal hippocampal z-score, which is a normalized value of the hippocampal volume, does not exclude the disease itself, and an abnormal one does not prove it. But if you use this well, if you understand that what is this measurement telling you, it is a very insightful data point that you can add to the other values that you have, the lab tests, the memory tests, the other risks that you're aware of. So this helps you make a better informed judgment, but does not replace your judgment. So that is the case for today. And the takeaway from this is actually the following. So when you encounter an AI result in a report, I think it's wise to approach it as you would approach any other tests that you have for your patients. So, but also keep in mind, how was this AI trained? So you could ask the developer, or you could ask yourself, how was it about what we call validation? So how was this AI trained? Was it trained and tested on data like yours, that represents your own population of patients. Also, it is wise to check the details. For example, the software, the characteristics of the software, the description, its efficacy, its efficiency, its safety, the scanner that was used, and does it also correspond, or is it similar to the scanner that you have in your clinic or hospital? And what is the normal? How was the normal reached for this specific AI tool? And also would be interesting to ask, for example, does this also fit your patient's history? So this is very important to keep in mind. It's always about your patient at the end of the day and not the AI itself. The AI is here to help you. So you can summarize it as AI measures, but it's your role as clinician to interpret. Thank you, and I hope you found this clinical AI round helpful, and see you in the next clinical AI round from Clinical AI Academy.